And I just mentioned also on your seats and in the back, I believe in the back also, these little cards are the same information, so you can take it with you, and so you don't have to write it down. I should have said that at the beginning, sorry.
I just wanted to say thank you for coming. And while we understand that your scope doesn't always apply to everything that we brought to the forefront here, in retaining and judging whether our services have been retained, I think you're hearing a lot of emotion, upset, anger, disgust, a lot of questions. And so I think, a broad interpretation of retaining means not to diminish and not to lose those services that we've been accustomed to.
We appreciate all that, and we're going to give that careful study, because I don't want to stand up here and interpret how the contract works exactly, but we're going to review everything you're saying very carefully. Yes, ma'am. Yes, ma'am.
Who makes up the advisory committee for Angel? Earlier in your presentation, you addressed the advisory.
I don't have all the parties' names right here, actually I might, but the advisory committee, to my recollection, is comprised of 8 people. 4 are appointed by the local hospital board itself, I believe, and the other 4 are appointed by HCA. Well, thank you again. We'll be around for a little bit. I'm sorry, one more question? Okay.
I would like to have further clarification on what will happen to the current campus at the end of 10 years. This is a follow-up to a question up here and behind me and over here. Who exactly makes the decision? You mentioned several people, several boards would be involved in deciding. Who exactly does decide at the end of 10 years?
At the end of 10 years?
Who owns the current campus?
I'm not here to interpret the contract, because there's lots of parts of it that we're focusing on the part that relates to compliance. It's my understanding that HCA bought the campus, and they provided some undertakings for 10 years. I don't know what, I guess it's for them to make that determination then. I believe so.
I kind of have a question. I think in your scope there, you said that they're supposed to provide surgical services. Did it not say that?
It did.
You were a CEO or whatever. Doesn't an appendectomy come under that?
Appendectomy is a surgical procedure, yes.
So you shouldn't have to be shipped to Asheville to have it done, right?
There's a lot
You're
of
supposed to have a
factors
surgeon here, and they don't have it.
Well, there's a lot of factors go into that. Appendectomy is one of 1,000 different surgical procedures. So
Isn't it one of the easier ones? I mean, supposedly, no? Okay.
I don't think there was anything specific that said they had to have that capability here. We'll look at it again. Again, we put 3 bullets up there describing surgical services. There's some narrative behind that. We'll take a look. But I don't recall them saying a specific ability to do that service.
You keep mentioning about the points in the agreement that apparently it's quite complicated. I tried looking for it online to see if it's public information, and the only site I found it on was one that you have to subscribe to.
I don't know that it is public, but it was made available to us, but I could be wrong. I don't know. What I think is a useful thing for you to do, if I could suggest, is there's an overview of the transaction and the agent and the undertakings that I got that was published by Attorney General Stein. and it's 2 pages. I pulled it off the internet the other day. If you wait a moment at the end, I'll show you how you pull it down. It's 2 pages. It's actually a nice summary, and if you listen to his 38, 39-minute video, I think most of what is in there he goes through on the video, but you can read it in 2 pages.
There's several other pages that follow it, that itemize things.
I beg your pardon?
There are several other pages after that that follow items. So I will glance down.
I looked at 2 pages. I pulled it down off the internet myself.
That probably is. The agreement that I found online is blurred, so you have to pay to get to it, and it's 160 pages.
Well,
Yeah.
It was a lot.
that sounds more like the purchase agreement. I have no idea if that's public or not.
Well, it is.
But I would recommend I would suggest you read the 2 pages from the Attorney General.
It's on the Democratic movements, Macon County Democratic movements. Look under Sheriff Ramsey's.
Okay, somebody. Is this PowerPoint presentation available online? It's not available online, but all of the undertakings, the key components of it are available, but not in this form. All 15 of the undertakings, I believe, are on our website. I think our team is on there, and the responsibilities are on there. So it's not in this form, but it's on, or the information's on there. Yes, ma'am.
I know I don't have a microphone.
Yes, you do.
Now I do. I've had a lot of people respond to me last night. We weren't aware that you were even going to be here. I had requested to find out some information because I had heard that you were going to be here, and somebody was nice enough to email me and tell me. But a lot of people were upset that it was done so early in the day that they couldn't attend, those that work a regular job and stuff.
So
Are they going to have it again?
Well, there's nothing scheduled right now. First of all, I'm sorry that you didn't hear about this until whatever day or two. We went through special pains to make sure that it was well publicized. We have a public relations firm that works for us, that helps us create all the materials and the website, and we posted an announcement of all the scheduled meetings, and I believe we sent it to all the local media in the area, and I believe it's been out for several weeks. I believe that we also...
I didn't know you did. I'm a physician in this community. I found out about this yesterday.
That's when last night.
I didn't get an email, I didn't get any calls, phone calls, texts, nothing. You should fire your public relations, because I found out about this yesterday.
Well, I mean, I know for a fact that he sent the information out. I guess it's possible that the local media here didn't receive it. I guess it's also possible that local media didn't post it, but we'll certainly look. Look, the idea is to have people here. That's the whole idea. And I apologize to you.
I would say that there'd be a lot more if this was more notice and more
Please encourage people who are not here to reach out to us, and if they have a question for us that we think we can answer, if they provide a way to contact them, we'll get back to them. Again, we want to be very clear that we don't create more disappointment than necessary by being sort of promising things we just can't promise. We're here to listen. This is a listening post kind of a thing, and I am sorry that you haven't heard. It's not that we didn't make an effort, but thank you, sir.
I think, and I don't want to speak for the question up front, but what was the rationale for choosing it during the middle of the day, during the middle of the work week? I mean, I guess I'm having a little bit of trouble understanding the rationale for the time. Fortunately, I work at an amazingly supportive agency who said, yes, we would like for you to come and represent our concerns. But even if you are looking at maybe an elder population in consideration, overall, the better time to have had this, especially in the largest community. I find it interesting that in Highlands and Cashers, both of the meetings were offered in the afternoon, late afternoon and evening hours, but here in the largest of the 3 communities, it was offered in the middle of the day. And I was wondering, could you speak to what was the rationale for choosing that time period as opposed to choosing a time period where folks weren't working necessarily?
The answer to that is I don't know the answer. The last 2 were done in the evening, I think there was a specific reason, but to be honest with you, I wasn't the person that set it up, and I don't know the answer here. It certainly, there was no malice intended. Like I said, we're trying to get as many folks as possible. I don't know the answer standing there.
Besides the newspapers, did you make it a point to contact all of the medical community in each?
We had a list when we publicized the event with the local media. We had a list of people. I don't know who. I think elected officials, others might have had some positions on it. I don't know the answer, but we did do sort of what we thought was a comprehensive outreach to publicize the meeting. I mean, what do we think there looks like about 50, 60 people here.
Just a comment.
Yes, ma'am.
Well-attended meetings here, you don't put in this building. You put in a much larger building, because I've been in community meetings in this county where we had over 300 people. I've been at one where we had over 500 people. This is a small community meeting. Franklin is very involved in affairs. Everyone is concerned about our community, our hospital, our schools. Those of us who can attend most of those meetings. And I'm angry, and I'm trying not to be, because my natural impulse is, okay, this is the problem. Now, how are we going to attack it? Well, evidently not through you, because your purview is so narrow. And I'm beginning to understand what your purview is. Attacking it through Angel Hospital have tried that now ever since they took it over. Had the same kinds of problems, including double billing, which was reported to the insurance company, and we proved it in 3 instances. There's a lot more going on, and I think at this point, as citizens, some of us are going to have to do some thinking, because something needs to be done. We are not being served in this community. If someone had explained to us what a transfer station was when this purchase was put up, I will guarantee you there would have been an uproar. I don't know what the current median age is in Macon County, but I will guarantee you it's somewhere around 70. A lot of those people cannot travel to Asheville. So they're left sitting here in Macon County with no medical care. And it's a large percentage.
To be a solution-focused person.
Yes.
So if I might make a suggestion, if you all choose to hold another forum here, I might recommend that your PR folks, for example, maybe spend a little time looking at how our folks in rural communities actually access information and where they access that information. Because unfortunately, I think a lot of times folks think, well, that's how they access it in Buncombe County. That's how they access it in Asheville, when really a lot of the ways we access our information here maybe looks very different than, and so I hear what you're saying. I don't fault the fact that I do believe that you believe that obviously that information was communicated with the community, but clearly I think we hear folks around the room saying it was not, and so I wonder if it's because the delivery of that information is different in rural communities than maybe it is in larger urban centers. And so that's, again, I'm solution focused. I want everybody in our community to be here. So.
I think that's a very constructive statement. Look, we're new to this process. We've only been involved since, sort of the end of October. we hit the ground running and got out into the community very quickly, saw all the hospitals, met with HCA, met with Dogwood, arranged to have these meetings. We wanted to get into the community and have these meetings very quickly. And you know what? Your point is a good point. I'm not going to promise you the next meeting here, because then I don't know what it's going to be. But I heard you loud and clear. If we think it would be useful to have another of these meetings, your point, the way we do it, the size of the room, the time of the day, thank you very much for telling us that. I really appreciate that.
On that note, I looked at the list of the meetings, and I think out of the whole list, most of them are at 5:30 in the evening, so you could have people that were working and people that were retired here. There were 2 places here, and I believe the other one was possibly Blue Ridge. It was the Blue Ridge and McNeil, one of the other rural hospitals, and they were at this middle of the day, which is very difficult for most of us that work full-time to get to. And a lot of folks that are supportive of Angel and HCA and things like that, I think, so I don't know, I know all you need is another meeting, but I'm thinking you might look ahead to the other one that's at middle of the day in another community, or see if we could possibly have one at 5:30 here to include more community members.
You mean the next time we have a meeting? Is that? What, I'm sorry?
Or an additional meeting,
Yeah.
so that, yeah.
I don't remember, I wasn't, there was planning, a lot of planning into putting these together, and the time of day and the venue was, frankly, I didn't do it myself, not that I want to throw anybody else under the bus, but I think there was a reason we did it at this time. Your point, I hear it loud and clear, how to communicate, publicize them, who to reach out to, all of that. I appreciate that input. Yes, ma'am.
I have a general comment for the audience, and that is that some of the things that we are experiencing in the community as far as hospital services are concerned and physician services are very common to rural areas throughout the country, and especially where Medicaid expansion did not take place. And that's true in North Carolina in general, but Western North Carolina in particular. So some of the things that we're experiencing aren't due to the HCA acquisition of Mission and Angel. Having said that, I think from listening to what the comments have been, there are several things that are concerning us. One is obviously the access to services, and everybody in this audience I know knows that obstetrical services and surgical services no longer are available in general at Mission, and that the new quote-unquote Mission, Angel, and that the new Angel Hospital is just a glorified and rather curtailed in some aspects emergency room. It's concerning to me that we're not going to see it for possibly another 8 to 9 years by the time they get it built, when the present facility seems to be rapidly becoming out of date and understaffed as far as physicians are concerned. So my concern to Mission is that they should be looking at their rural providers and making sure that their physician recruitment is appropriate. As Laura said, if they're putting people here in on a 6 to 12 month contract, that ain't going to cut it as far as delivery of services is concerned. It just is not. And my other thing that I know about and have picked up from you guys is this question of transportation, and that the lag time from admission here at Angel to services in Mission is untenable. Absolutely cannot be continued. We can't have people waiting essentially a day for what should be minor surgical services. That is not acceptable, absolutely not. And again, we have to look at the fact that rural areas, especially where we haven't had Medicaid expansion, are having great difficulty in maintaining medical services. And so I urge you not to blame HCA for everything. However, I urge you to keep on at them to make sure that they know what our concerns are in this community. And meanwhile, all I can say is we do have an alternative, but you have to go over the mountain.
Thank you very much. Gentlemen.
I think most of the comments today have been HCA comments, not Gibbins, since your role is to simply do
Happily.
thank God, right? Compliance. And I think if you can take back to HCA that they should be a representative from HCA corporate should be in this community every 30 to 60 days with a publicized meeting date and time, so that these concerns go directly to an HCA person, that they hear the concerns of the community, not having to depend on you to send it to
We'll pass it
them.
on.
I think they should be here on a routine basis until we grow into this.
Please keep in mind that we have only 2 newspapers in town now. One is published on Wednesday and the other is published on Thursday. And so notification needs to have a lead time.
Thank you.
I've also web services, skimp or none. And a lot of us are elderly. I happen to be computer literate, but a lot of folks are not.
Hello? Hello?
Yes, ma'am.
Does the agreement with the Dogwood Trust fall under your control or
When you say,
input?
which agreement? I'm not.
The Dogwood Trust that was going to disperse so many millions of dollars to each community?
That is not under our purview.
Okay.
I think I already know the answer to my question, but I'll ask it anyway. Are the transcripts of any of these meetings or the questions and answers, will they be made available on your website?
I hadn't
or
planned on
any
that.
way
Let us think about how practical that is, but no, I hadn't planned.
Okay.
So I have a quick question. Community partners with the hospital. Is that fall under this? Because as community partners, the agencies that I work for, I'm confused. We have worked with Angel Medical Center and had great, in the past has never been a problem. Now, getting contracts done with HCA, Angel, impossible. We don't get it done. We can't get our clients scheduled. Our clients, they try twice to schedule them, cancel them. We don't know who to call. When we call, we have to call the X-ray department or ultrasound department, radiology, ask for people. We have people that are not high up helping us solve problems. We have clients who we are trying to do things for. Our patients are getting told mixed messages. We pay part of a bill for a patient from some of our programs. When we pay for those programs,
our patients are now being billed the remainder of the cost. And so we're frustrated as a community partner. We don't know who to talk to or how to get things done. I don't have a contact. I don't know who's the person I call at the place. We used to know who those contacts were. We don't hear who those contacts are. We don't know who to go to. How do we fix things? We want to be a community partner. We love the Angel. We love the hospital. We love the people that work there. And we have worked hand in hand with them. And we don't feel that hand in hand anymore. We feel like it's, well, you're just, an outside agency, and we don't feel that community spirit anymore.
Yeah, I mean, at first, look, the contract's complicated, and it doesn't sound to me like this sort of falls within, but, I'd like to think about it and read it again. But I think irrespective of whether it's in or out, this information that we'll pass on, I think the HCA would be receptive to hearing, and I think they would tell you, based upon what they told us yesterday, I think they would ask you to, talk to the local CEO and speak with them, because they're very interested in outreach. All right, well, thank you very much again. Like I said, we'll be here for a little bit, and we encourage you to communicate with us directly. I'll try to find a phone number for you right now.
That sounds muddy. I had the microphone over there. I had to put it right under the head. Man. Oh, sir, how you doing?
I know we've got whatever it is.
It's 120 days after each of the fiscal year ends, and I have to provide another report demonstrating their compliance with capital expenditure program. I think that's a month after that. So now we'll talk a little bit about the advisory boards and our role. So there are 5 local advisory boards, and we are an advisor to the local advisory boards, and I'll explain in a moment what that relates to. And we're also an advisor to the seller entity. 5 local advisory boards, the mission board in Asheville, and the seller. So our role, so for the seller entity, again, the responsibility on this will shift to Dogwood in the middle of the year. We think that's the thinking at this point, is to monitor and enforce compliance of the undertakings. And to do that, we are establishing listening events. I'll talk a little bit about other ways to contact us. We speak with we speak and periodically visit the local hospitals. This is our second time. We were appointed at the end of October. We were, I believe, in the field here with seeing all the facilities in November. It's likely we will be back in the field again, either right before or right after we receive the annual report, which I think is going to be at the end of April. So, and then the seller representative, the seller, is required to enforce compliance based upon advice we give them on whether HCA is complying with the undertakings. Now, the advisory boards, I think we mentioned when we went through the 15 items, is the hospital, the HCA cannot sell or close the hospitals for 10 years. HCA must continue the services we talked about before for 10 years. And for 10 years, they cannot modify the charity care policy. Except in the event that they ask to change those policies can only be changed with the consent of the advisory boards, and in certain instances also with the consent of the independent monitor. So our role in that regard is, in certain instances, we act for ourselves because we have to provide the consent, and we also advise the advisory boards on any determination on whether to give such a consent. That's our role. So I promised 5 to 10 minutes. Hopefully I've lived up to that. That sort of summarizes HCA's undertakings. It summarizes the role of the seller and the advisory boards. And again, one of the things we wanted to make sure we did, and the Attorney General emphasized the importance of this to us when we met with him in December, I believe, or his office in December, is we wanted to hear from you. In addition to publicizing these meetings and everything, we opened up a website just for the role of the independent monitor back a couple of, maybe a week ago, I'm not sure. Here's our website. On the website is some information about our role, some of the things we talked about today. There's also a mechanism on the website for you to contact us. Provided, there's a field for you to fill in with any questions, comments, concerns, issues, anything. You can provide us with your name and contact information if you wish. If we have questions to just try to understand what you're saying, we'll call you if it's necessary. But you also don't have to give us any contact information. Totally fine, not a problem if you don't. And if it's easier for you, you can just send us an email. So I just want us to go over one thing that I forgot to go through, and if I could just take a second more to go through this. Give me 1 second. This one of the things that we were asked about early on, and I just want to emphasize this, is that we're not working for HCA. We're not hired by HCA. None of us are involved in engagements with HCA, and that was a requirement in being hired, and that was all hardwired into the purchase agreement and insisted upon by the Attorney General. We're not paid by them, and we're not doing other work with them. I just wanted to mention that because I forgot to when we were on this page. So at this point, we'd like to open the floor to comments and questions. If anybody prefers not to speak up themselves, you can provide a piece of paper to Donovan or Jennifer, who are with us to help on that sort of thing today. I want to just sort of say at the outset, and we're trying to emphasize this every way we can. The role is about facilitating and assuring compliance and facilitating consents if they're ever requested. No requests, to my knowledge, are on the table right now, consents to change anything, so I don't think that is truly relevant at this moment. We're certainly also required to assist the advisory boards review information provided by HCA, but the key issue of providing assistance on consents is not relevant now. There are no consents requested. So while we're happy to listen, and we're more than happy and eager to hear what you have to say, it's possible that some of the things that you're going to ask about are sort of outside of the undertakings of HCA. Don't worry about it. Ask anything anyway. If they are, if they are within the undertakings, we'll note them, and that'll help us do our job. If they're not part of the undertakings, we'll pass them on to HCA anyway. regular scheduled meetings with HCA on the telephone and in person to talk about issues and compliance along the way. And they've expressed, certain interest in hearing that. They've also asked us to mention that, in terms of, again, we don't want people to be frustrated because they think we're going to be able to solve problems for them. And they asked us when we spoke to them yesterday, we had one of our scheduled meetings, is that, in order to sort of, to actually take some action, they ask and suggest that you speak directly to the hospital CEO, who's really in a position to actually turn the dials and pull the levers to make things happen. So with that, we'll open the floor. The only thing I would ask before we do is, for your information, we, in order to make sure we capture all this correctly and accurately and can act upon it, we're recording this and we'll get a transcription so that we make sure we don't miss anything. And we'd ask that if you speak, that you wait, we'll provide a microphone to you, and that way we'll make sure that your question is recorded properly. Again, nobody needs to provide their name or anything. This is all about just making sure we capture information. So I'll pause there, and Tom and I will try to be responsive here.
I'll be the first one to break the ice.
Please.
I have a question.
Hang on one second, Lou.
I have a question concerning the hospital. What will happen after 10 years if it's not profitable? Does it go back to Macon County?
It goes back to?
It goes back to the original people that built the building, supplied the building, took care of the building.
Well, I think, as I understand, the HCA bought everything. They provide an undertaking. Basically, look, the contract's complicated, but we read it regularly. They provide an undertaking not to sell or dispose of it for 10 years, with very limited exceptions, and only with consent of the advisory boards. But after 10 years, I mean, I think that's when that undertaking sort of burns off. And I believe, to the best of my knowledge, there are 9 more years left.
9 more years. I have one more question,
Please.
and I don't know if you can help me with it, but
Tom, did anything I say you disagree with? Make sure the two of us make sure we check on each other.
all right. I had a kidney transplant, so I was going to Angel Hospital every other day to have blood work. And every other day that I went, I had to supply, in order to get some assistance, copy of my W-2 and a copy of papers proving, that I needed assistance. And I did that for about 6 months. And then they sold, and I wasn't aware. And I went to go to the billing department, and they were closed. So I tried to reach out. I thought it was Mission, and they said they weren't in charge, that I had to call this other number. And I spent, no exaggeration, at least 15 phone calls trying to straighten bills out that I had, and I couldn't get a response. I finally did reach out to somebody. They told me they saw, they wanted me to send a copy of my 100% compliance that I, was eligible for assistance. Well, since then I hadn't heard anything. Then all of a sudden I start getting bills that they're putting me in collection. And I had been in contact with them. I have dates, people I've spoken to and everything. Nobody ever responds. And I finally reached another girl, which was probably about a week and a half ago, and I sent 3 times fax, 3 times a copy of my W-2 and all the information. And I get another letter saying I'm going into collections. How do I resolve that, since nobody responds?
I don't know the answer to that. I mean, right, so I think this relates to the charity care policy. Okay. Appreciate you telling us this. We'll note it. We'll report it. I think the thing you need to do is to talk to the hospital CEO or someone at the hospital, because they're the only ones who can do anything about this. There are, as I understand, we did review the policy, and I think there are things that the patient needs to do in order to comply. I have no idea if that happened or not, but I think we're happy to appreciate your providing this input. We'll pass that along. But I think the people who can do something about it are the hospital.
Yeah, because I've been calling. I have every person, all the bills, everything. I have lists of names and everything, and I haven't been able to get anywhere. And I'm trying to keep on top of it, but I don't want to be put in collections, because of some bills and stuff. And they said, oh, it's in the system. It says, don't worry, disregard that. So I disregard it and never get anything in the mail. And then I get another letter that I'm in collections. So that's my concern.
I appreciate that.
And I'm sure a lot of people that have gone to the hospital must have the same issues with the billing, because you can't get anybody to respond to you. I know that you can't, but I need a number or someone for the CEO so I can voice my concerns about all the bills that I have. These are only just some of them, and this is only for the last 4 or 5 months.
We'll make sure they hear this, and if you want to offline tell us, your name or something, we'll pass that along to. That's fine. But again, Tom, I don't think there's anything that we actually can do except note that and report it back to them. I guess the question is, are they complying with the charity care policy? I don't know the answer, but it's a piece of information.
Yeah. The people that I've spoken to have been very nice, but I'm not getting nowhere. It's just constant calls, but I write everything down. So I have every person I spoke to, every date, everything, and I have not been able to get anywhere with it, so.
Okay, thank you.
Yes, sir.
Your Honor.
Well, I've been called worse. Appreciate very much y'all being here today. And I'm sitting back here with a couple of guys that we remember in 1971 when this community came together to buy that hospital. Since then, we never would have dreamed, or I never would have dreamed, that we would see rural health become for profit rather than community service. Where we are right now, you can take this back, I think there has been a disconnect between HCA and the community. I do not think the disconnect was because of any people that work at Angel. They have gone overboard. But there has been a disconnect. As the mayor, I have yet to talk to any very high-ranking HCA folks. I would be more than happy to take them around, let them get to know our community, and try to express to them the kinship that this community has had to that when it was Angel Community Hospital. It's completely changed now. I feel like a lot of us feel like HCA is something somewhere out there, maybe in cyberspace, we don't know where. But this is the main thing we've got. The other big question in the community is what's going to happen to the old hospital. I don't think that's been adequately answered. I know they're going to build a new one, and I understand the latest figures are somewhere in the neighborhood of $68 million. The question I would have for HCA is, if you've got that kind of money, why have we not renovated the existing facility? Thank you, sir.
My name is Jennifer Turner-Lynn, and I'm the Assistant Director Outreach of Macon County. We provide services for victims and survivors of domestic violence, sexual assault, and human trafficking. So, wearing my agency hat, we actually have 3 very specific questions. The first is that until the mergers happened, we actually never had an issue with obtaining forensic nurses to provide forensic rape kits and forensic examinations for strangulation victims at Angel Medical Center. Since the merger, I would say that 99% of the time, we are responsible for transporting victims who have been violently sexually assaulted, trafficked sexually, or who have been strangled and physically assaulted all the way to Asheville to have an examination, which is unconscionable and inhumane. In addition to that, if Angel does the transport, for example, the amount of time that the victim must wait to receive the medical transport by ambulance, again, is unconscionable. The last rape kit that I did, where I took a victim to Mission, we were there for 13 hours. That is only one of many examples. In addition, prior to the merger, we never had an issue with rape victims being charged for the use of the emergency room. We now are being billed, victims are being billed for the use of the emergency room at Mission. Again, that is unconscionable. In Asheville, that is unconscionable. The last victim that I took over received a bill for $1,000. The only services that she received in the emergency room was to have the rape kit performed. When we try to reach out to, again, resolve these issues, I will go back to what Mayor Scott said, the ability to access, because it is like this entity that's just out there somewhere, to resolve those issues is impossible. When the services were localized, the ability to reach someone to actually resolve if there was a billing issue or a billing question was much easier. And so those two, and I would also say that there seems to be a very large lack of communication, the flow of information between Angel to Mission when somebody's transported. So for example, when we were told to go to Mission not too long ago with a rape victim, we went through the emergency room process. We had a sealed envelope to make it as discreet as possible. And the person there at the desk actually asked us, "Why are you here?" And so we tried to very discreetly say, "Well, we're here, because this person needs to have her rape kit done." And she goes, "No, I understand what you need to have done, but I don't understand why you came to this hospital." There's a big disconnect between the fact that we are having to go to Asheville to receive services because those forensic services are not being made available at Angel. My second specific issue is related to the fact that the transportation of individuals, and this is actually, I don't know how many folks in this room know this actually impacts a lot of people in Macon County. We only became aware of it because we had a situation with a victim. We had a victim who was in our shelter who actually had an emergency situation. They had a stroke. Ambulance, our paramedic services picked them up, transported them to Angel. Because their situation was serious, they were then transported to Mission. Upon their release, the individual was not returning to our shelter because they needed additional care that our shelter was not able to provide, so they were going to be with a family member. Mission contacted us to tell us that either we had to pay $300 to have this victim transported back to Macon County when she never said that she needed to go to Mission. They transported her to Mission. And the policy had always been that if you were transported there, that they would be transported back to their county of origin. That apparently has changed. And so now if you're somebody who is poor, doesn't have a vehicle, doesn't have a family support system with a vehicle, and you're transported for services to Mission, they are not willing to transport you back. They're not willing to pay to have you transported back. You yourself will have to find a way to get back to Macon County, and you have to pay for it if you want them to arrange the transportation. Those are all significant issues that impact our rural community residents, and again are unconscionable. That we would place individuals who are homeless or poor in those positions where they have no resources or no way to get back to their county of origin is really just unthinkable. So thank you very much.
I appreciate that. I listened very carefully, and again, we're recording this, so we'll read the transcript very carefully again. Without sort of diminishing the importance of everything you just said, we need to review it and determine from our perspective whether it falls within compliance of the undertakings. Nevertheless, HCA will provide a catalog of these issues to them, and they'll hear from us. Sorry, this gentleman right here.
Thank you for doing this. My name is Jesse Urban, and I just wanted to speak of, there's obviously some kind of rough speed bumps during this transition, and one that I became aware of at Mission Health Center Highlands, because I thought there'd be less of a waiting time there, but it appears that there's a major disconnect during the transition where after a lot of research and talking to different customer service representatives at that particular facility, and it sounds like based on the complaints they're getting at other facilities as well that are based on the campus of the hospital, they sometime in July or August of last year changed their general place of service code, which is a really important code, from code 11, which is more for like primary care, office practice of the physicians at a facility like that, to code 22, which is just an outpatient type or hospital setting. And it's an amazing difference in terms of insurance and whatnot. The cost of like a $20 copay to, in my case, for just a simple office visit, ending up getting a $600 bill subsequently, a month or two afterwards. And that's fine if they want to operate that way, but the amazing thing is that they've basically almost done this change for the service code in secret. My insurance, Blue Cross and Blue Shield, is not aware of it, and I'm still trying to get them to update their website information that says that a visit to this location will use your primary care services with a doctor there. And also the actual doctors that are practicing at that location are basically unaware of it. The office manager is getting a tremendous number of complaints about this, but talking to the doctor and her assistant, specifically Dr. Wheeler, that they are still under the impression they're providing primary care service, and so the patients are under that impression. But in the reality of billing, which is quite important, it's not the case at all anymore since last July or August. And it's just this amazing disconnect that they admit that on the phone, customer service for Mission Health, that this is no longer a primary care facility. It's just an outpatient facility. But they're still essentially, at that location, the doctors still think they're providing that service, and it's just an amazing disconnect or dropping the ball. And I just also want to mention, I did contact finally HCA Corporate. They do have on their website a phone number you can call, and there's a complaint line. So supposedly they're looking into this, and I would suggest other people, and they said they've never gotten any complaints about this. So I'm thinking most people don't know about looking up the actual HCA healthcare website to get their phone number, because Mission Health, several customer service representatives are just reading through all the complaints they were getting about this issue. So I think people need to reach out more to actually HCA at their corporate website and phone number for any complaints they have. But I guess my last kind of question is if it would be appropriate for you guys as the independent monitor to kind of receive and compile complaints, that this is quite serious in my understanding. I know that HCA has even recently been indicted in lawsuits of kind of fraudulent billing practices as a kind of class action lawsuit. So unfortunately, I'm afraid another kind of class action lawsuit for this kind of fraudulent billing issue might be the only thing that resolves it. Hopefully they do resolve it, but they're making a lot more money, unfortunately, because of the way they're made this change and still operating as a primary care facility. And I'm afraid this is occurring elsewhere as well and impacting a lot of people. So I don't know if it would be appropriate for you guys to receive complaints about this that could eventually be compiled or used for like a class action type lawsuit, because I know you are independent of HCA, which would be, I can't really think of who else could kind of compile these complaints for something like that.
I mean, listening to what you're saying, Mr. Urban, it's easy for me to remember your name because it's the same as
It's amazing.
It just at first blush, it does not sound like it's within the undertakings or our scope. Again, we promised from the very beginning that, I mean, we'll read it again, listen to it carefully, see if there is anything that gives rise to compliance issues. It doesn't sound like it to me, but we'll certainly pass it on, and I would encourage you to speak directly to HCA and including local leadership.
Okay. Well,
And they've expressed to us that they are very receptive to that.
okay. I appreciate hearing people's comments today.
Yes, sir. My name is Ronnie Bill. I'm Vice Chairman of the Macon County Board of County Commissioners. And first of all, thank you for being here. As you can see, a lot of our residents have not had much contact when it comes to the transition of the hospital. And we want to impress on you how important the hospital is to this community. Without the hospital, we're in real trouble. So, but I have a few questions concerning Gibbins. We're meeting with the Attorney General tonight. He's coming to this neck of the woods. So, number one, let's do the math on the new hospital. We're already a year in, correct? In a 10-year deal to build a new hospital, correct? And if it takes 4 more years...
I think it was, my recollection, I could be wrong, sir, I thought they said that it was going to be 5 years on the Angel replacement.
I believe it's 10 if you'll look. They get a they have a 5-year clause. I'm pretty sure, I lost my license.
You might be right. I have to go back and look.
Okay. So, but let's do the math. The plans have not been submitted to the state. It's my understanding the architect is not finished with the plans. So if we're on the 10-year plan, if we're on the 5-year plan, then we're already way behind if you know how the state works approving a hospital. So I'd ask that Gibbons look into that. I think that comes under your watch.
That might, we'll look at that.
Yeah.
I'm not sure, but it's possible. It does sound like, I mean, look, the Angel commitment is certainly one of the HCA commitments. And I believe compliance on that is one of our things.
Okay.
So yes, we'll look at that.
Okay, and another thing, if Gibbons does find a default in any of the agreements that was the contract between HCA and the Attorney General, so if you do find fault, would you mind telling the folks what the process is as far as Gibbons is concerned,
Sure.
according to that contract?
So the responsibility for compliance is on the seller. And again, that responsibility will transfer to Dogwood, we understand, toward the middle of the year. We advise Dogwood, or we advise the seller on compliance. There is a process under which the seller then has to, the report will come from HCA at the end of April, I believe, and another report regarding capital expenditures will come about a month later. And then there's a period after that by which the seller needs to determine whether there's a compliance issue. And we will advise the seller in that regard. We do not act on our own on compliance. We are a tool to the seller in that regard. And then I believe the way it works is that in the event that the seller does not take an action and the AG determines that an action was appropriate, the AG could, if it differed with the seller, could take an action on behalf of the seller. But that's the process. We advise the seller, we review the materials, we take in information from a lot of different sources, we determine if we think there is any compliance problem, we see if what HCA itself says about compliance, and we go from there.
And I have one last comment on the existing hospital. We've had the conversation, we'll have it again this evening, about, I think the community, the county could not by itself, but we went to Washington, we met with the senators about, we have so many options for that building. The VA, behavioral health, the behavioral health beds in Axel are wonderful. They also have some in Waynesville we don't get to occupy. So it's a big behavioral health. And with that building, with the combination of folks and with the state involvement and the county involvement, we still think it's a very viable building for our community. And we just don't want to hold it around, to tell you the truth. We want to make use of it. And so, I know that's out of your wheelhouse.
It is, but I'm sure HCA is be receptive to talking.
We think it'd be a very nice gesture for them. We'd offer them $1 right there. We think that'd be a very nice gesture for them, for the community, because we are going to have to be partners. I mean, we may not like everything, but that was out of our realm. But now we want to be partners. We want to be good partners because it only does help the community. So we appreciate what you do, and we ask that, and I'm sure you'll be diligent in your job, and we appreciate you listening to the citizens. This is what matters, is what's in the room. So, but we appreciate you.
With respect to the bill, that's clearly something you're going to have to talk to them about. We'll pass it along.
One other comment, if you would, from myself. While we're talking about things to take back to HCA, there is a perception in the community that this new hospital will be a transfer site to send you on to Memorial Mission. Right now, I hear more about that from the community than anything. Just what services will this new hospital render, and will it be short of services that we have become accustomed to? So that's one of the main things that I think you need to get back to them. Plus, emphasize that we're in the middle of 4 counties that really are getting pretty shortchanged on rural health care right now. And thanks again. I'll echo what my partner over there, Ronnie, said. We really need to move on what's going to happen on that hospital, the physical plant.
Similar to Mr. Urban's issues, I have 2 providers here, one at Mission Women's Health and the other one at Angel Orthopedics. If you call their office, they tell you they are in network for United Healthcare and Aetna. If you call United Healthcare and Aetna, they are out of network. So you're receiving bills that are kicked out of the system, pay in full or go to collections. Same thing, I've been calling the billing department at Mission for 9 months over 2 bills from May 23rd. My insurance companies have called them too and told them that they know what the problem is. They're using the wrong billing address. It's different than the one the insurance companies have on file, so it kicks it out. All they have to do is correct the address. I had to drive to Ashley yesterday to see a doctor I could drive a mile to just to get it covered by insurance. She's upset because she thinks she's in network here, so that needs to be corrected. Also, I'm wondering under what you're overseeing, their commitment to leave the hospital open, I'm wondering, are they committed to leaving doctors in it? Because they're running them all out of town. And a realtor I spoke to yesterday said that there are new people coming to town who are looking for rentals because their contracts are for only 6 to 12 months. They're not planning on hanging around here. They're only giving them a contract for 6 months.
I understand. I think, look, the contract is kind of clear on the undertaking and the terms of the services. Billing issues, my recollection, it's kind of silent on, or at least the parts I reviewed. Again, this is information we'll pass on. They're hearing it today. Appreciate you telling us.
And I would say the same thing. The people in the billing office are very nice. I think they're stuck in the middle. There's never a supervisor available to speak to. I can't speak to accounting. We keep telling my insurance companies they'll resubmit the claims, but they don't ever do that. So I think they're stuck. I think they're being told what not to do, what not to say.
I have no idea if that's accurate.
Right, I understand that.
Pretty suspicious.
Hi, my name is Pat Thomas. Last year, I had a friend who had a very unfortunate situation with appendicitis, which I've always thought was not a terribly, difficult situation. But anyway, he went to Angel, and they said, yes, you have appendicitis, but we don't have a surgeon. So we're going to have to ship you to Mission, to to Asheville. 11 hours later, they got him over there to Asheville. And the doctors there said, well, there's a lot of people ahead of you, unfortunately. Hopefully your appendix doesn't rupture. Well, it did rupture. And he was in the hospital for much longer than he would have been for an appendectomy, a normal appendectomy. So anyway, it was a very, very bad situation. He waited a total of 23 hours from the time he got to Angel till he had the surgery in Asheville. And I was very concerned about this, so I emailed HCA at their office in Tennessee. And I got a very quick, and told them the whole situation. Got a very rapid response from them, fortunately. And the person said, well, we're going to forward this to the authorities in Franklin, because there's nothing really, she didn't say that there's nothing we can do about it, but we'll forward it. So about a week later, I get an email from Karen Gorby, who was the CEO of, I don't know if it's Angel or Mission. But anyway, basically she said, well, those things happen. Sometimes that we don't have people, specialists at Angel that can take care of this. And I was totally ticked off about that. So I wrote her back and said, you missed the entire point of my email. So when you say to contact HCA, lots of luck. When they tell you to contact Karen Gorby here, who is way over her head, in my opinion, to be running a hospital system like she's running here. It's horrible. And I've heard so many stories, so many people who have never received a bill from Mission for care, but they were turned over to a collection agency before they ever got a bill. I'm waiting on a bill from Mission. I haven't gotten one yet, and they better not turn me over to a collection agency. But anyway, I know there's nothing you can do about this, but you did say all this information that you're collecting today will be forwarded.
Yes.
And HCA needs to know that their interests are not being taken care of here in Franklin, North Carolina. Thank you.
Thank you very much.
I can report one positive thing, that I know that they are interviewing for new doctors. Of course, we don't know the process, but we know that that is happening, and that is a positive for us because, and our EMS director, Mr. Warren Cage, is here today, and I think he will tell you that we averaging already 5 to 6 trips per day from Macon County to Memorial Mission. And a lot of these are on Macon County taxpayer time. There's no, if Medicaid won't pay, what Medicaid does pay for that service, as Warren will certainly tell you, does not cover the cost. So as far as the transition hospital, we're there. And that being said, we're a whole lot, a county in North Carolina, their hospital just filed bankruptcy. They're for 165,000 people in that county. They're buying 24 new ambulances and hiring all these people to transfer people now. So, could it be worse? Yes, but we're worried about Macon County. And so as far as it being a transition hospital, of course we don't know that. That was not spelled out for the services, but I think it requires to have an emergency department and some other things but our population, HCA needs to understand our population in this county and where it's going. It's the people 65 and older, the population is doing this, which means more than likely, and statistics prove that, healthcare is more and more important. And availability of healthcare. It don't seem like, from here to Asheville's no big deal. It is a huge deal for a lot of these folks. And to get it there, and Mr. Cade will tell you that we have become a transportation service, which is fine. That's what if the people here need it, and Mr. Cade knows if he needs more adjustments on that budget, but HCA needs to realize, they own a lot of hospitals, and that's fine. We're worried about this one. So And if you would stress that through Gibbons, I think that will be done. I think Gibbons will do that. So, but we are interviewing for new doctors, which is a huge, and hopefully they'll come. So that's a positive note.
Thank you.
2 months ago, we were in an emergency situation. We are with the Mission program, have been for about 7 years now. And we ended up in the emergency room with a urology problem. It was said to us that it was a life problem. We stayed there for 10 hours. They said, you will be contacted by our urologist tomorrow. Okay, we were not. We called, well, I went back to the emergency room. I said, okay, we haven't heard from him. What do I do? Is he running no temperature? Yes, he is. Then you need to bring him back to the emergency room. Now, I don't make mistakes twice. I put him in the car. I took him to Duke Life Point. Within about 3 hours, our problem was answered. It was answers that we had looked for about 6 months were given to us. And I am furious because when HCA bought Angel, they set up services for urology, and they said that they would be there twice a month. This is a PA, it's not a urologist. He had 2 appointments. On the third one, on the day before it was due, which was about 4 days before this happened, they called to cancel the appointment because the urologist PA was not going to be here. And they remade the appointment for the day before this happened. We go to the appointment to be told, oh, that appointment's in Asheville. You need to drive to Asheville. Not in a situation at that point where we could drive to Asheville. So HCA is not maintaining the services that they had when they took over the hospital. The urologist only comes once a month now. And for the number of patients that she's covering, that is not close to being adequate.
Thank you very much. Someone passed a note to us. I want to just mention, we'll put this on the list. A question regarding, I just got bullet points, so that the issues concerning the patient assistance program, patient medical records being, I guess, required to be retrieved from Asheville, and questions about losing specialists. So we'll put that on the list also. But I just wanted the group to hear what we've heard from others.
I'll add my billing complaint just while we're at it.
Could you?
So I got into a car wreck when I was 34 weeks pregnant here in Franklin. I couldn't get treated here in Franklin in a car wreck when I was 34 weeks pregnant because they have nobody on staff to deal with that. We ended up going to Mission. Well, my son was actually born in Harris since it was closer, and Mission picked him up. I didn't get to hold him or see him after he was born, and he had to go to Mission because he wasn't breathing on his own. We spent 2 weeks in the NICU in Mission. While we were still in the NICU in Mission with our son, I got a call from collections from his birth and from being treated from when Mission, the first bills that Mission got had already been sent to collections while I was still in Mission with our son in the NICU. So we were only there for 14 days. I don't remember what day that hit, if it was the 10th day or how long it was, but we got our first call from collections while we were still being treated by Mission in the hospital that I had to go to Mission to have my son. Had I been able to deliver him here, that wouldn't have even been a problem, and they could have helped him here, but his birth was delayed so much because we had to go to Mission because we couldn't deliver in Franklin. And then when Mission picked him up, I didn't get to hold him, I didn't get to see him. I got to see him in a box wheeled to an ambulance that I couldn't ride with him in. I couldn't get there because Mission didn't have a room for me to come and join my son until the very next day, so I had to stay in a hospital away from him, and was away from him for the first 15 hours of his life before Mission. And Mission couldn't even send an ambulance because they didn't have one to come and pick me up from Harris to go see my son. So I got discharged 6 hours after a C-section in Harris. And my husband drove us to Mission because that's the only way we could be with our son that we never even got to hold, because Mission couldn't take me when they took him and didn't have a room for me until the very next day, even though they took him, on top of getting calls from collections while still in the NICU in Mission. So I know that's not under your purview. at this point don't really know what's under your purview, but it's not, that just is so not acceptable, and what a mother needs to be worried about when she's watching her son hooked up to every tube that could possibly be hooked up to, knowing that everything that led up to her having to be there was because of the lack of rural health care in Western North Carolina.
Other questions or remarks?
I just want to second the need for the maternity ward, because I think my son is one of the last born at Angel, and it's been 3 years. That's a lot of driving over Cowley Mountain, and especially in the state that it's in right now. Thank you.
We want to thank you very much for coming out today and providing your remarks and your comments. As I said and promised, we will channel all of this information to HCA. We encourage you also to speak to HCA directly, but we'll review it to determine if it falls within our scope. But even if it doesn't, we'll channel it to HCA. As I said before, we encourage you, if you want to provide further information of any kind at any time, you can reach us this way. It's anything you want to tell us, specific, non-specific, that's fine. We'll treat it very seriously.
Do you have a phone number besides the email? Because I'm sure some people don't use these.
I have, we have a phone, a general number for our firm, which I need to dig up. I'll give that to you certainly. I got a call today that I have to follow up with. Generally speaking, it's fast. We get a printout. Well, if they don't use the internet, it's not going to do much good. We'll find a way to get there.